Did you know that some diabetes patients never wake up in the morning simply because of a silent complication that happens while they sleep? It is called nocturnal hypoglycemia, a dangerous complication, often overlooked, but in reality, it can take a life at any time. In this video, we will explore the causes, symptoms, risks, and most importantly, how to prevent it to protect yourself and your loved ones. If this is your first time here, don't forget to subscribe and turn on the notification bell so you won't miss important elderly health tips. What is nocturnal hypoglycemia? Hypoglycemia happens when blood sugar drops below 70 milligrams per deciliter. For healthy individuals, the body usually balances itself. But for diabetes patients, especially those on insulin or glucose-lowering drugs, the risk is much higher. At night, the risk becomes even more dangerous. While you are asleep, you cannot sense the warning signs or act quickly to fix them. That's why nocturnal hypoglycemia is called the silent killer of diabetes. Why does it happen at night? Several reasons contribute to this condition. Taking too much insulin or medication before bed, eating too little or skipping dinner, leaving your body with no energy to last through the night. Drinking alcohol before bedtime, which blocks the liver from releasing glucose. Exercising late in the evening and burning up glucose without replenishing. Stress, anxiety, or hormone imbalances that disturb your body's natural rhythm. Every one of these factors can lower blood sugar, but combined, they turn nighttime into a dangerous battlefield inside the body. Symptoms during sleep. Most patients do not wake up to describe their symptoms, but there are subtle signs. Some experience nightmares, sweating heavily, or sudden jerks of the body. Some toss and turn, breathe heavily, or mumble in their sleep. Family members often notice something is wrong before the patient does, and in the morning, never increase doses on your own. Eat a balanced dinner with complex carbs, vegetables, and lean protein. Never skip dinner. If needed, have a small bedtime snack, whole grain bread, a boiled egg, or an apple. Avoid alcohol completely before bed. If you exercise in the evening, refuel afterward. And most importantly, check your blood sugar before bed. If it is low, eat something light. These simple steps can be the difference between waking up alive or not waking up at all. The role of technology. Technology is saving lives. Continuous glucose monitors, or CGMs, can track sugar levels every few minutes. They sound alarms when levels drop too low. Some models even connect to smartphones, waking family members if the patient does not respond. For elderly patients living alone, CGM devices can be a guardian angel at night. The importance of quality sleep. Sleep is not just rest, it is medicine. Research shows that 7 to 8 hours of quality sleep help regulate insulin and hormones. Poor sleep, on the other hand, raises blood sugar during the day, creating a vicious cycle. So, set the stage for healthy sleep. A quiet, cool, dark bedroom. No blue light from phones or TVs. Relaxation rituals before bed. Reading, meditation, or light stretching. When the body rests deeply, it can better regulate blood sugar and protect against dangerous swings. Foods to eat and avoid at dinner. Dinner should not overload your system. Avoid white rice, pasta, and refined starches that spike and then crash blood sugar. Instead, choose whole grains, beans, and vegetables for slow, steady energy. Snack options like unsweetened yogurt, almonds, or oats can stabilize levels overnight. On the other hand, sugary desserts, bubble tea, or late-night alcohol are a recipe for disaster. They raise blood sugar sharply, then drop it suddenly in the middle of the night. Common Mistakes patients make. Thinking the leg changes. Earlier dinner, a light snack before bed, and adjusted insulin doses. Now, he sleeps peacefully and wakes refreshed. His story shows that big results can come from small, consistent habits. What does science say? The American Diabetes Association recommends checking blood sugar before bed, especially for those on insulin. A UK study reported that more than half of type 1 diabetes patients experience nocturnal hypoglycemia at least once a year. The World Health Organization warns that hypoglycemia is one of the most common emergencies in insulin-treated patients. Another study found that patients who ate a balanced dinner with slow-digesting carbs reduced their risk by over 30%. Science is clear. Lifestyle choices make a huge difference. More practical tips for safety at night. Keep glucose tablets or a sugary drink by the bedside in case you wake with symptoms. Inform your family about signs of hypoglycemia so they can act quickly. Create a bedtime routine. Check sugar, eat if needed, relax, and then sleep. Schedule regular follow-ups with your doctor to adjust insulin doses as your lifestyle changes. These steps build a safety net around your nights. Closing message. Nocturnal hypoglycemia, a dangerous complication of diabetes, can strike silently. But with awareness, discipline, and support, it can be prevented. Eat wisely, take medication properly, avoid alcohol, check your sugar before bed, and make sleep a priority. If you want more elderly health knowledge, make sure to subscribe to this channel. Never ignore the warning signs. Even one severe episode can leave lasting brain damage. Remember, sleep is not just rest. It is healing time for your body. With the right habits, you can sleep safely, wake up strong, and live longer. Sleep well and wake up safe every single day. If you found this video helpful, please subscribe to our channel, give this video a thumbs up, and share it with friends or